if I may just interject a comment in response to Diana's sharing, I've been so deeply appreciative of learning their approaches to economics, gift economies, ways of ensuring that everyone is taken care of. And I'm going to be quoting you, holding everybody up. That's an image that's going to be in my mind forever. So thank you so much. So I want to now express my deep honor and appreciation also to be introducing Dr. John Millar. He is the former Bonnie Henry of BC, quote-unquote BC, again on most of these stolen unceded lands. He was the former provincial health officer, or is the former provincial health officer, and he's here to talk about his perspective, his lead in developing a health-focused Green New Deal policy platform with the Public Health Association of BC. I've had the privilege of organizing with John through First Call, Child Youth Advocacy Coalition, Poverty Reduction, and a few other groups, the Policy Action Research Committee of the Public Health Association of BC. All these phrases are mouthfuls. And so he's going to be here to share about that and the links between basic income, climate justice, and health equity. Thank you so much for being here today.
Thanks so much, Sherry. Can you hear me okay?
Yeah, you got to get right up so you can touch it.
Okay.
Maybe, Bruce, can you help make it taller for him?
Oh, for sure, yeah.
Right on. Because you are a tall fella.
There you go. I'm going to stand a little bit there so you get a bit closer to the. Is that better?
How's that now? That sounds
That's
better.
awesome.
Okay. Good afternoon, everybody. Thanks for coming out. I'm going to start off with a bit of gloom and doom here, but I'm going to try and wind up on a more positive note. We're confronting a whole bunch of crises. Some of them are really big, like COVID. We're all struggling with COVID, and you'll hear more about that later. But even more important is the issue of climate change. And that's what threatens all of us. This is the biggest existential threat we face. If warming continues, we eventually will disappear as a species, and so will the rest of the species on the planet. So this is a huge existential threat ahead of us. And compounding those huge issues are a bunch of smaller but very important issues like ongoing poverty, ongoing
It's
homelessness,
turned up as high as it can go.
ongoing unemployment, as Diana mentioned already, racism, Indigenous peoples, oppression and marginalization, and other people of color who are oppressed as well. So we've got all of these crises that we're trying to deal with. Okay. What are the causes of all these crises? Well, unfortunately, they come down largely to our economic system, our system of a free market with inadequate controls to it and unbridled capitalism, which leads to the huge concentration of wealth at the top of the pyramid and far too many people living homeless and impoverished at the bottom of the heap. And ultimately the value system that puts money and profits ahead of people and the environment. So let's turn to how we can do something about this. The solutions to this, first of all with COVID, is to make sure that we do have adequate protection for everybody. People have got masks, they're separated and so forth, and we move to full immunization for everybody that's willing to accept it. And in many circumstances, that's going to have to be mandated for people to be at work, particularly in healthcare systems. But with those measures, we can seriously anticipate the end of COVID and moving on. But with the environment, with climate change, we've got bigger challenges. The first thing we're going to have to do is phase out fossil fuels in the next decade or two. And that's a major, major challenge. And we could do that in many ways through legislation and so forth, which we'll talk about. And one way of doing this is for every municipality, in fact, every level of government, endorsing a treaty for the non-proliferation of fossil fuels, a fossil fuels non-proliferation treaty, internationally, nationally, right down to a municipal level, so that we can get everybody in the world on track to eliminate fossil fuel production and usage. But of course, there will be huge job loss associated with this. People moving out of the fossil fuel industries will be displaced into other areas. So how do we deal with that? This is where I'm going to switch to a more optimistic perspective here, folks, because we do have an opportunity to totally transform our society, so that it largely goes under the words of a Green New Deal for Canada. It's a framework for how we can move ahead and transform our society. The important elements of a Green New Deal, number one, is creating millions of new jobs in renewable energy, wind, water, solar, geothermal, and so forth. Those jobs need to come with good pay and good union supports and more worker ownership and all of those types of things. But we also need to create jobs in the caring areas, child care, elderly care, long-term care, care for the disabled, mental health and addictions care, and on it goes. But in addition to those many forms of new green jobs, we need jobs that are in where's my notes? Oh, energy efficient housing, low carbon transportation, and so on and so forth. And then the other thing, which many of you have come here for today, is a universal basic income. We've got great evidence here that people that are moving out of one job into another job are going to need financial supports, but it goes beyond that to other people who can't work or can't get employment for whatever reasons. We've had ample experimental evidence going right back to the 1970s in Canada with the Income experiment to Dr. Evelyn Forget in Manitoba, which showed that giving people a adequate basic income actually improves employment, improves health, reduces healthcare expenditures, less hospitalization, and so forth. So it can be paid for and financed. Thank you. Then, in addition to that, as I've said, the introduction of a basic income actually has a profound effect on health. Just this week, it was announced that soared, which is the Canada Emergency Relief Benefit, which was $2,000 a month, thanks to the NDP nationally bumping it up from what the Liberals wanted at $1,000 a month up to $2,000 a month. And the introduction of that actually reduced the suicide rate in Canada by 32%. That saved 1,300 lives in Canada, which is what we in public health call a natural experiment, showing what the pilot studies had shown is that by bringing in that kind of expenditure, it saves lives and saves money to the government. So moving ahead, we also have to provide better and more adequate public education, public carbon-free, free transportation, more affordable and energy-efficient housing, and so forth. And thank you to Diana for the pointing out that First Nations in this country have been oppressed and marginalized and discriminated against, and we do have to bring in legislation around UNDRIP, the United Nations Declaration on the Reconciliation of Indigenous People. And we have to, in addition to the First Nations people, we have to address more widespread racism and, as Diana said, gender discrimination as well. So there's a lot of work to be done here. And how can we finance all this? As the federal NDP is advocating, we can do this through taxing the wealthy, making them pay their fair share, and through doing that and bringing in the basic income, we can reduce this terrible problem of the inequality of wealth and well-being in the country, and that is slowing up the economy in itself. So by taxing the rich and bringing in the basic income, we can have a thriving economy. We can save the climate, and we can have a happier and healthier population. So, folks, we can really truly transform our entire society and our economy. But what does it require? It requires, for those of you that are out here today, what you're already doing. It requires political activism and getting our democratic system to vote in the right leaders and the right policies. So keep on doing what you're doing, and thank you for your attention today.
Thank you, brother. Awesome. Oh, 1 second. We'll do that.